us now via Skype from Ramallah in the West Bank is Hiba Tibi, Care Country Director in the West Bank and in Gaza. And I do want to discuss what's going on in the West Bank as well, because we've seen, serious protests there overnight. But let's start with what happened in Gaza and this deadly blast at the hospital. What do you make of what you are hearing at this point?
Good morning. Thank you so much for having me. What happened yesterday is terrifying. Hundreds of people were killed in the attack on the hospital. For us as humanitarian organization and under the international humanitarian law, the protection of health worker, medical services, wounded civilians, and also all the civilian buildings is non-negotiable. What we are asking for and what we are looking at is that the terrifying moment that we have seen can be used as an inflation, where we can request an immediate pause, where we can allow for humanitarian assistance to access civilians, and those in need of medical support are evacuated.
It's not clear what President Biden's objectives are in this visit, whether or not he is trying to prevent further Israeli retaliation at this point. But as you understand it, as far as these humanitarian corridors are concerned, what's been achieved at this point?
Unfortunately, there was not a lot of achievements when it comes to accessing humanitarian services, which is the basic requirement of all the international organizations, humanitarian organizations working on the ground. There is lots of shortages of basic and essential requirements, necessities, including food, water, shelter, medicine, and fuel. If all of these requirements are not made available, as you have seen from different officials on the UN, this will lead to a catastrophe and will have the biggest impact on civilians, including women, kids, elderly, those who are very vulnerable, and as we all know, they are the ones paying the price of the highest price of the war. The turning point of all the events happened back in October 13th, when there was the order for evacuation of the north of Gaza. 100 million moved towards the south, and with that movement, the already exhausted resources in the south were overwhelmed, and the civilians who tried to seek shelter in UN schools and other clinics, UN-owned clinics, they are still facing all of these very harsh, severe circumstances. And just like everyone who tried to evacuate towards the south, I also have my colleagues in the south who are also living the same conditions. So far, services are almost shutting down in terms of accessing to water, medical services. And over the last period, you would find all of the attempts by international humanitarian organizations who are trying to facilitate the access to basic needs are focused basically on two things: water and medical supply. And for instance, I can give you an example of what we have achieved over the last period is simply to secure water, drinking water, for instance, or medical supplies, hygiene kits for the civilians, which is not going to solve the issue. What we all request and we hope for is an immediate ceasefire, where all parties are abiding with the international humanitarian law and allowing all of the humanitarian organizations to fulfill their mandates and support the civilians to meet their basic needs that are really running short in this very tough time.
And Hiba, we know, because we've seen the images and we've got reports of what is built up on the Egypt side of the Rafah crossing, an enormous amount of aid, medical supplies, fuel, water, sort of building up on that side of the Rafah crossing. And it's just a question of how at this point the conversations go in order to get that in. We've just been showing pictures of Ramallah overnight. That is where you are. The big fear,
Yes.
of course, was what is going on in Gaza between Israel and Hamas, but clearly now massively affecting Palestinians in Gaza. There was real concern about how this may spread, how this may escalate across the region. And let's start with Ramallah. I mean, what do you make of the protests that you will have witnessed last night in the West Bank?
So, very frankly speaking, the tension is building up, and as a humanitarian organization, we also don't forget the situation in West Bank. It's not only Ramallah, but across all West Bank. Over the last days, we have seen increased number of violence incidents and casualties, which make all of us really running against time to make sure that we are prepared. Although no one can be prepared for war, are prepared to also potential interventions, humanitarian interventions in West Bank as in Gaza. That has been said. Very frankly, we are focusing all of our work, all of our energy now on Gaza, trying to secure as much as we can in the West Bank. There are some measures that we have taken, especially in our field of intervention related to health supplies and health services, where we have our mobile clinics, for instance, on the standby. Medical supplies are secured, and we will try to, as much as possible, or again, no one can be prepared for war, but try to also coordinate with different actors. Who is going to do what are the different roles, so that we can avoid an additional or a bigger situation where we have to fight over or find our ways as humanitarian organizations for saving lives on two or both sides, West Bank and Gaza.
Yeah. Hiba Tibi, just getting to the root of just how tough this is for an organisation like yours, looking at what is going on in Gaza, trying to ensure that you can provide sort of, substantive logistical support in Gaza. So what is going on in the West Bank, of course, very much in focus for you as well. Thank you very much indeed for joining us. I know times are very, very tough for an organisation like yours and for you and your staff. Still to come.